I came into the world of rare diseases as a result of our daughter, our firstborn child, who was diagnosed with trisomy 18 at 7 days old. And she lived for 71 days, about 2.5 months. And as a result of that, it was really a career change for me. I was a plant geneticist, and then I really redirected as a result of our experience and our introduction into the whole rare diseases and congenital disorders world. I think the most important thing really is getting a diagnosis. In many cases, for many conditions, we know that there are 7,000 rare diseases that have been characterized or identified, but for so many of them, they don't have a diagnostic test necessarily, and there's so many conditions that don't actually get diagnosed. And I think it's the first most important step is just knowing what you're dealing with as a parent, but also from the other side, and kind of bridging that gap with the healthcare provider and professional in terms of knowing what you're dealing with so you can better provide the care, support and management for that condition, whether it's a severely life-limiting condition with only a few hours, days or weeks of life, or a longer-term, more chronic life-limiting condition with years. I think we have to take a step back actually from infrastructure, because we have, historically in South Africa, we have a lot of good research going on in South Africa. I think the real key is translating that into actual treatments and that translational aspect of research in terms of just making it applicable for the patient. And I think we face a lot of hurdles in terms of that. Traditionally, a lot of the research and development that goes into diseases and healthcare has focused on those that are most prevalent in high-income countries and developed countries first. And then it's been prioritizing other conditions, infectious diseases such as HIV and so on, that are more prevalent in low middle-income countries. So in terms of rare diseases, it's only those that are important to the high-income countries that really get a look in and a say. And others that's, we're at the bottom of the list. And it's actually fighting and leveraging for that. And I think in South Africa, we have a lot of infrastructure, but it's just getting everybody to work together and unite, and so that we work as a whole, rather than individual little silos. I think the most important thing is sharing and communicating information, because we don't want to waste the little resources that we have and duplicate effort. We need to really take a rationalized approach and streamline and find out, and share what we're working on and share our resources best, because we only have a limited pot of funding. And if we're all trying to do the same thing, to build our own, particular facility or institution, we've got to think about this nationally and with global, a global context as well. So to see where South Africa fits into the whole rare diseases and congenital disorders global community as well. So I think it's important to not have blinkered vision and to really think wider. We almost need to turn that question around and almost demonstrate how researchers can benefit from patients. Because we know that patients really live with a condition every day. They are the lay experts and they know more about the condition in reality than any healthcare professional or a doctor can actually know. And obviously we wouldn't expect every healthcare professional to know every condition. It's just not possible. So I think there needs to be more of a recognition of patients as being equal with healthcare professionals, and so that they can share the knowledge that they have, and to help link up with relevant patients, because we know that there are very small patient numbers of a number of rare diseases, for example, and finding patients to be included in a cohort for a particular research study could often be a challenge for a researcher. So, and I think this is really very much where rare diseases comes in South Africa, to actually bridge that gap and bring these two stakeholders together, which we know it's been very difficult. But I think with the internet and all the technological advances that we have today, that it's bringing them much more into a place where they can communicate much more easily. Rare Diseases South Africa, we've recently added research as one of our strategic pillars. which is really exciting because this really provides that evidence-based approach that we really want to underpin all the other work and focus that we're spending our time and attention on at Rare Diseases South Africa. So it really underpins the advocacy and the support and the community engagement. So what we're trying to do is we're trying to really enhance that unity in the R&D community in South Africa around rare diseases and congenital disorders. We want to provide an opportunity to connect patients and really bridge that gap between the patient community, support groups, and the research and development community, so that we can actually help get that patient voice in there and that patient centricity and ensure a two-way flow of information, so we can actually help guide the research agenda from a patient perspective, help fill the gaps, and also by sharing information and agendas of different institutions around the country, try and promote this whole, working together and this almost united approach rather than, enforcing those silo mentalities. So with regards to ethics, I think we've learned from mistakes that have been made in the past all around the world with regards to poor ethics and ethical undertaking in research, where the patients have not benefited from the research. But I think the framework and legislation that we have in South Africa now around ethics provides that framework. The onus is on the researcher to ensure that they, are compliant with research ethics and the legislation that we have. But I think we can't put it all on the researcher. I think we know from the patient charter in South Africa that the patient also has to take responsibility for their own health and to be informed. So I actually feel that while yes, the researcher does have, there is a necessity for the researcher to take full responsibility for what is required to ensure that any benefits are shared, any possible risks, and the informed consent process is undertaken completely comprehensively. But I think the patient needs to, and I know that we need to ensure that any research programs and projects are actually communicated appropriately, so it's understandable and relevant language for the patient to understand. But patients and we as individual South Africans need to take greater responsibility for our health ourselves, and so make sure we understand what we're getting into. I don't think we can plead ignorance anymore. And I think there's a lot more space there for collaboration to actually improve that. And I feel that we as Rare Diseases South Africa can actually help promote that as well.